Morning. Thank you for attending. Lisa, thank you for sending out the notifications to the people that will be joining us on the Facebook Live vigil following this event. And Matt, thank you for volunteering to help me get the sound equipment out to North Chicago on what might have been a cold day had we been going through with the planned vigil. So I'm Adam Broad. I'm co-organizer of Our Revolution Lake County, and my friends here with me, my wife and comrade, Dr. Lisa Peck, and my good friend for many years, Matt Sobchak, are all fellow progressive activists here in Lake County, and we are acting in solidarity with National Nurses United to remember the nurses who have died from COVID-19. We're remembering all the frontline healthcare workers, including doctors. Not gonna spite Lisa's colleagues. I guess they're all colleagues. All right. We're nearly 10 months into this pandemic, but nurses and other frontline workers still do not have personal protective equipment, PPE, they need. As a result, over 2,000 frontline healthcare workers have died from COVID-19 that we know of. Meanwhile, too many elected officials and healthcare employers continue to downplay the seriousness of the pandemic, but we know just how real and devastating COVID-19 has been. As union members, healthcare workers, and community members, we have witnessed the devastating effects of this pandemic's mishandling. In countless hospitals across the country, frontline nurses and healthcare workers are still being forced to treat COVID-positive patients without proper PPE. Some have been told by their hospital employers that they don't need to wear an N95 mask to treat COVID-19 patients. In some hospitals, management has even locked up N95 masks on the hospital premises to stop nurses from getting the protection they need. It's become clear that healthcare employers value their profit margins over the lives of their frontline nurses and healthcare workers. For thousands of nurses and healthcare workers, the only solution offered to them by their employers has been to reuse the same N95 mask repeatedly. In over 2,000 lives lost, we've seen the horrible consequences of this mishandling. Today, we are here to mourn and honor the lives of nurses and frontline healthcare workers, raise awareness of the failures of government officials and healthcare employers, and discuss what is desperately needed to better protect the people who work to protect us every day. Well, at this point, I would ask Lisa and Matt if they have any personal reasons why they're here in solidarity.
Okay, I'm here because although I'm not a frontline worker, I do see patients with COVID after they've recovered, and I've seen people who are having long-term complications from it. I've talked to people who have lost their health insurance, which was a big problem even before COVID, but COVID has demonstrated that our healthcare system is inefficient, inadequate, and extremely expensive, and we need to fix more than ever. Fortunately, I work for a healthcare system that does provide proper PPE, but I am disappointed and feel it's tragic for some of my colleagues who don't have that, and we need to change all that too. And I'm hoping that we can convince our elected officials that we need to have universal health care. Healthcare is a right, not a privilege.
Matt, do you have a personal reason to be here?
I mean, I don't personally know frontline workers, but I mean, I've lost a cousin to COVID, which he was not a frontline worker, but it's also, just as Lisa said, the whole healthcare system is a mess, and the last people that we should be crapping on are the frontline workers. I mean, they're the people that are helping, who's, you know, there for us. If I get sick, if you get sick, whatever, that's who we have to rely on. If they're not there, if they're not able to do it, we're, you know, up a creek, as they say. So you know, it's important. And it is, it's definitely, it's an echo of the whole larger system, larger healthcare system, and just, you know, societal attitudes in general. We really have to change that. You know, the healthcare is important to everybody. Healthcare is something we need to have a healthy, functioning society. You can't. How can you build a strong economy on sick people? It's screwed up and backwards. So, you know, solidarity. Let's go.
Thank you, Matt. I see.
He agrees.
Oh God, they love it. Yes.
Georgia de la Garza has joined us, and Georgia is one of our co-organizers of our revolution in Southern Illinois, and I understand there was another nurse that died from COVID in Southern Illinois just the other day. Do you know anything about that? And do you have a personal reason to be here in solidarity with the nurses who have died from COVID?
Absolutely. Them being our main caretakers when we're lying in the hospital suffering with COVID. I'm a recent survivor myself. I had a very bad case of it, and now I'm considered to be a long hauler. And I did something really stupid right before I was diagnosed with COVID. I let my insurance just expire because I was going to hunt for some others. So I didn't have health insurance at that time. And it was like a week later, I was diagnosed with COVID. And I was just scared out of my mind what I was going to do. You know, the bills are coming in now and it's just ridiculous, you know. So I've got to seek out some help for that. But I'm just thinking about, you know, everyone else who doesn't even know who to reach out to, you know, at the time. But first and foremost, I've supported a Medicare for all because of the doctors and nurses and frontliners. I know a lot of my family members who are on those front lines who are caught in this tangled web of the corporate socialist of medicine, you know, and being an environmentalist, it even pisses me off more because they make us sick. They make us eat these heavy metals and these chemicals and these poisons. They give us cancers and kidney diseases. And then they charge us to you know, mask symptoms or to experiment on us, or, you know, whatever. It's just a total failed system. And then we have people who have that heart spirit that want to be those caretakers, like our nurses, right? And they're putting themselves in such incredible dire straits, and it's just heartbreaking that we let this happen, you know, that we have let this happen. So I'm just trying to work on a lot of different fronts, you know, to push forward Medicare for all. So not only we have better health care, you know, I tie it with the Green New Deal too, that we have better health, you know, in our environment and we have better health care for Medicare for all, but that we can create safe jobs for these people that want to be in these positions of caretaking, you know, for us, and want to do this profession. And where would we be right now with that? What if nurses decided, I'm not going to be around this, I'm out of here? We know we saw a little bit of percentage drop, but we didn't see a lot of nurses and doctors walk off the job when COVID hit. We saw them push their sleeves up and dig in, you know, and we're losing them. We're losing them also. You know, what we need to do something. So I'm here in support of that. The whole picture, you know, the whole picture of healthcare and frontliners.
And thank you so much for sharing, you know, Georgia.
Yeah.
And I don't know, no one. This virtual event was hastily thrown together because I am now in quarantine because I had some symptoms, and nobody here was nobody here knew that I was gonna on live camera throw them on into the event and ask, you know, what's your reason for being here? And for Georgia, it's not surprising that someone who's an activist, when I say personal reasons, that the political and the personal are tied together for those of us who are passionately volunteering whatever time we have to try to make a positive difference and make our system what it ought to be. Matt Muchowski, another one of our Revolution Lake County organizers, has joined us. I would like you to share your personal reason to be here in solidarity.
Sure. Sorry, I'm still cleaning up from Halloween. So kind of hopped on at the last minute. But yeah, my name's...
thing that happens at a vigil, but this is not a normal vigil, and these are not normal times.
Certainly not. Yeah, so my name is Matt. I'm a organizer with AFGE, the American Federation of Government Employees. We are a union that represents federal employees. We represent workers at the VA, and they've been on the front lines of this crisis, as well as, you know, any number of veterans' health crises over the years. And, you know, the VA gets a bad rap. You know, a lot of these Republicans are frightened by how effective a government-run healthcare system is. And the fact is that the VA provides excellent care for millions of veterans across the country and is a model of the sort of healthcare system that the rest of us could have. My union, AFGE, has passed resolutions supporting single-payer healthcare, supporting Medicare for all. And, you know, it's something that I think the labor movement as a whole, you know, can really, it'll improve all workers' situation. You know, a lot of times when unions are bargaining for better healthcare in their union contracts, they stalemate on issues of healthcare coverage. And a lot of times unions will take concessions on wages or other concerns they have in order to secure good health coverage. So if we were to take that bargaining chip away from the employer's toolkit, if we were to make it so that all workers were guaranteed income, whether they were employed or not, whether they were union or not, I think we would see that unions would be able to bargain more effectively on all these other issues, right? So it's, you know, it also really boils down to the concept of solidarity, right? Which is that we stand up for each other, we help each other, and that's what unions are about, and that's what single-payer healthcare would do.
Helps if I unmute myself. At this point, we were going to read a list of names of nurses who died from COVID. I'm going to do something else. I'm going to share my screen for a moment. Give One moment here. Share screen. This morning I Googled this. Nurse dies from COVID. About 76,300,000 results. We see that top story there. Honeybrook nurse who cared for coronavirus patients dies of COVID-19, leaving behind a daughter. That's just the one that popped up on the top. Sorry, that was just one nurse. What I'm going to ask everyone to do, instead of sitting through a list of names, is to take 10 to 20 minutes and Google nurse dies from COVID and just read some of the individual stories about who these nurses were, the children and families and loved ones they left behind, and the work they did. I'm lighting this candle in memory of the nurses who died from COVID. And if you have a candle at home, you could light that for them also. So if you're a person of faith, you could pray according to your individual faith or meditate. Send healing positive thoughts for the loved ones and the comrades of these nurses. And I'd like now for just a moment of silence. Thank you. Throughout this pandemic, our elected officials have utterly failed us. Congress has failed to act to protect nurses by addressing our immediate need to scale up the domestic production of PPE and other critical medical supplies. Instead, our elected officials have called for less COVID-19 testing and directed the Centers for Disease Control to change its guidelines to limit testing to people with COVID-19 symptoms, despite the overwhelming evidence that COVID-19 is often transmitted by individuals who appear otherwise healthy, or even transmitted by the President of the United States, who apparently only had psychological problems. They've installed political operatives, not public health officials, not public health professionals, at the top of our public health agencies, even going so far as trying to censor the CDC's weekly scientific reports that thousands of public health professionals rely on for accurate and timely information. Frontline nurses and healthcare workers have been crystal clear about what is needed: full implementation of the Defense Production Act to produce proper PPE for every healthcare worker every time. And while the House of Representatives included this demand in the HEROES Act, which was passed back in May, the House then passed the second version of the HEROES Act that still included our demands, but the Senate is stalling until after the election to pass another relief bill that could include this critical protection for healthcare workers. Our senators are not just playing politics with the lives of healthcare workers, they are putting us all at risk. Tonight, we grieve the nurses and healthcare workers who did not sign up to sacrifice their lives, but who lost their lives regardless. And tonight, I ask all of you to honor them by calling your senators right now or tomorrow demand they stop playing politics and protect frontline nurses and healthcare workers by supporting a full implementation of the Defense Production Act to provide proper PPE to all frontline healthcare workers. This is the important part. Please call 202-335-6015 and enter your zip code. That's 202-335-6015 and enter your zip code. And I'll be repeating that couple more times. 202-335-6015 and enter your zip code.
I put it in the chat if anybody wants to look at the chat, the phone number's there.
I want to thank everyone for joining us here. Our work is not finished. COVID-19 has shown that now more than ever, healthcare workers need allies to ensure they get what they need to keep themselves, their loved ones, and their patients safe. Tonight, we mourn. Tomorrow, we fight harder than ever. And if you get a chance to see this video posted or to see any of the social media tweets or Facebook posts that I put out, please repost and share on your social network with the hashtag #ProtectNurses, and also tag your representatives, your senators, and at National Nurses on Twitter and Instagram. I'm going to take a quick screenshot to send to the National Nurses. There we go. Cute. And now I'm gonna
Adam,
go redo
my-
this. I'm gonna go redo
Yeah,
this. Not what?
I
Oh,
got my video on, so you can redo it.
oh,
Do the
okay.
screenshot.
Yeah, we don't want to leave Matt out. Hold on a second. Get the union guy in there. All right. Hold on one second. There we go. Lisa had a little blue icon on. There we go. There we go. Actually, I could do one with each of you in the center. I'm gonna go repeat this entire vigil on Facebook Live right now. So thank you for joining, and perhaps you can join us on Facebook Live. I'm gonna get that going. So
Thank you so much, Adam and Lisa. So appreciate both of you. And I'm continuing to send really good healing vibes to you, Adam, that, you come through this okay. And something else, I've lost 4 friends with COVID. My best friend I lost. It was a 3-week hard battle. And I just want to put something out there that people don't think about. It was the nurses who kept in communication with us the whole time, all throughout the day. That was our link to my friend Mike. And that's another big job that they have. They too have to go through that emotion, family after family, person after person. So send them as much spirit and strength as they can get from us. So thank you so much. This is so important. Thank you.
yeah, thank you so much, Georgia. I'm gonna just add one more thing. I have an old friend, her name's Taryn, and she's a nurse at a nursing home, and she got COVID working in a nursing home, and she was sick, and then she got better, and she went back to work, and then after being back at work again, she got sick again. So she may be reinfected. We don't know. I'm a little worried about her. So just
Sending
an
your
old friend and comrade from way back, and just want to give Nurse Taryn a shout out. And that's it. No.
I'd like to share a couple stories, if I may, from some of the nurses that I've worked with at the hospital and some of the doctors from the ICU. Our critical care doctors are working 24/7. The nurses working 24/7. They've turned over their outpatients to us primary care doctors and to other pulmonologists who are filling in because they're in the ICU. And, you know, they're really dedicated, hardworking people. And the nurses as well, you know, for a long time, people are not allowed to visit their loved ones in the hospital. And I think that's starting to happen again as the numbers are going up. So the nurses, the CNAs, the orderlies, these are people who through FaceTime, Zoom, you know, all those, thank God for all those things, because that's how they've been communicating with people and their families. And, you know, people have been dying alone in the hospital, and these healthcare workers are connecting them, like Georgia said, to their families and loved ones. And I think that's a really important job that they do. So then thanks to all of them for doing that as well.
Thank you. I'm going to unmute everybody. And just, is there anybody else that would like to say anything before I sign off and head over to Facebook? Okay, thank you again for being here in solidarity with the nurses. So.
Thank you.
Thanks.
And just one last reminder before I cut for anybody that happens to be watching, that number again to call, 202-335-6015, and enter your zip code. We want to tell our senators, support full implementation of the Defense Production Act and provide proper PPE to all frontline healthcare workers. It's too bad this isn't a right-wing Supreme Court nominee. It would have happened already. It's the lives of our nurses. Thank you. Solidarity, brothers and sisters.
Solidarity, man.